Why are some TB chest X-rays blurry? Imagine looking at a photograph where some parts are sharp and others seem hazy or foggy. That's similar to what doctors see on a chest X-ray when they look for tuberculosis. The blurriness on these images isn't a mistake or a problem with the machine. Instead, it reflects real changes happening inside the lungs because of the disease. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis, which triggers the body's immune response. This response leads to inflammation, the formation of small inflamed areas called granulomas, and sometimes tissue death or necrosis. These changes in the lung tissue affect how the X-ray passes through and what the image shows. When tuberculosis is active, especially in its reactivation form, it often causes parts of the lung to fill with fluid, inflammatory cells, and bacteria. This process is called consolidation. These areas become denser and less transparent to X-rays, so they appear as cloudy, ill-defined patches on the image. These patches are usually found in the upper parts of the lungs, which are common sites for reactivation TB. Sometimes the infection causes small round spots called nodules, and in more advanced cases, it creates cavities or holes in the lung tissue. These cavities often have irregular, poorly defined edges, adding to the blurry look. In some cases, especially when TB spreads widely throughout the lungs, the X-ray shows many tiny nodules scattered everywhere. This pattern is called a miliary pattern and makes the lungs look hazy or foggy overall. Other changes like fluid around the lungs, known as pleural effusion, or enlarged lymph nodes can also be seen, but these are usually more distinct and less likely to cause blurriness. It's important to understand that the appearance of a TB chest X-ray depends on how advanced the disease is and what form it takes. Primary TB, often seen in children, might show different signs like lymph node swelling or lesions in the lower parts of the lungs. In contrast, reactivation TB in adults usually shows upper lobe consolidations and cavities. The blurriness indicates active inflammation and tissue damage, which are hallmarks of ongoing infection. This hazy or cloudy look on the X-ray is a sign that the lung tissue is not functioning normally because of the infection. But it's crucial to remember that these findings are not unique to TB. Other lung infections and conditions can produce similar images. That's why a chest X-ray alone cannot confirm TB. Healthcare providers use it as part of a broader diagnostic process, which includes sputum tests for TB bacteria, molecular tests, and sometimes advanced imaging like computed tomography scans. In summary, the blurry areas on some TB chest X-rays are caused by the inflammatory and destructive changes in the lung tissue due to the infection. These changes make parts of the lung appear hazy or cloudy, reflecting active disease. While these images can suggest TB, they must always be interpreted alongside symptoms, medical history, and laboratory tests. If you suspect TB or have concerns, it's essential to consult a healthcare professional for proper diagnosis and treatment.